Hi, before we start this ASMR video, I'd like to thank all these members on my Patreon for their continued support. If you're looking for any content that I create on other platforms, check the link below. Now, let's get into the video. Hi, thanks for coming into your cranial nerve exam today. I'll be your doctor today, Dr. Woe, as you might know me. I'll be going through 12 of your cranial nerves today, testing your strength, testing your motor functions, and testing your eye functions. Are you all right with that? Good. First things first. Before I start any of my exams, I'd just like to make sure that I have the right patient. Could you please tell me your name? Good. And your date of birth, please. Your home address? Perfect. Do you know the postal code or zip code wherever you are? Good. And what's your phone number that we should have on file? Great. Now, I'm going to be going through a variety of things, like I said. Just need to confirm this information that you gave me there. Good. Let's start with step 1. Excellent. Let's get into it. First function I'm going to be looking at is your eyes. Cranial nerves 1, 2, 3, and 4. I'd just like you to follow this pen light for me, okay? Nothing too hard, nothing out of this world. Just follow the light and tell me when you can see it. That's good. Just keep following that light. Any difficulties following it? No? Good. From the other side, just tell me when you see that light show up in your peripheral vision. Good. Any difficulties with that? Great. And just from the top. Good. Any difficulties there? From the bottom. Good. Doing excellent. Got a little smudge there on your face. Your friendly doctor's giving you a chance to not leave my office with that on there. Let me just have a look at that. Good. All right. So, cranial nerves 1 and 2 are great. Now I'm going to come in from your sides. You just let me know when you can see them, okay? Good. When I do that, any double vision? Any blurriness? No, that's good. Just keep following this light as it goes up from all directions. That's good. When I did that cause any dizziness? Did you see more than one light? No. And what color was the pen I was holding? Good. So, cranial nerves 2 and 3 are good. Now I'm just going to look into your eyes. I need to look at the back side of your eyes, and then I'm just going to test your pupils and see how they dilate. See whether or not they're reactive to light or not. So just, can you look up for me, please? Thank you. Excellent. Good job. Just going to look down, pull your eyelid down a little there. That's good. And then just look there as well. Look down, keep looking down. Good. Just look up for me. Thank you. Good. Now, do you wear contacts, glasses, or anything of those sorts? Now, when I shine the light into your eyes now, I'm just looking to see the black parts of your eyes, your pupils. Do they dilate when there's no light? And do they... I've seen so many patients today, I can't picture the word. Do they get bigger or do they shrink? When I shine the light in, they show to get smaller because they don't need that much light. They don't need to be as big. Let's have a look. And good. Good. Equal and reactive to light. So what I'm doing here is when I shine the light in, your pupils should get smaller because they don't need to be as big to let light in. When I remove the light, the pupils should dilate. They should get bigger. That way, your eyes can let in more light and you can see me or your surroundings. One more look here. Good. Good. Excellent. Cranial nerves 1, 2, 3, and 4 are spot on. It's been about 6 months since your last checkup, so any noticeable differences in your sight? No? That's good. Just going to test your depth perception now. So I'm going to cover one eye, and I'd like for you to tell me if you can still see me and whether I'm blurry or whether I'm clear. Just going to cover that eye. Can you still see me? Good. All right. Can you still see me when I cover that eye? Good. I'm going to cover your eyes completely, and then the moment I take off the lens cap from your eyes, I'd like you to tell me, can you see me? Am I in focus or am I blurry? Ready? Here we go. All right, I've covered you up, and then here we go. Was I clear or blurry to you? Let's try that again. Clear or blurry? One more time. Clear or blurry? Good. The other side of this, there's little holes poked in here. You can sort of see through them. I'd like to put it right up to your eye. Tell me if you can see a faint image of me at all. Can you see me at all? Can you see any types of movement? If you could or could not, that's totally fine. It's just for my sake of understanding to see if your eyes and nerves and cranial nerves work in conjunction to try and form a photo. Good. Let's just brush some of this off your face. I just need to have a couple looky-loos at your skin. All right, just let me have a look. Good. That's good. Just look up for me one more time. And then look down. Excellent. Squint your eyes really hard and then open them for me, please. Squint, squint, squint. Good. Yeah, don't mind my sandwich breath, sorry. All right, I'm just going to listen to your heart, and then we're going to get to cranial nerves 5, 6, 7, 8, and 9. Listening to your heart is not one of the nerves. All right, just have a look there. Just listening to your heart, that's good. Good. Nice and steady. Now I'd like you to take 6 deep breaths, just gonna listen to your back. Could you say the words 99 for me? Go ahead and say it. And again, say 99. And again, 99 for me. Good, let's listen to the other side. And 99. 99, say it again. And one more time, say 99. Great. No issues there. Lungs sound nice and clear, and your heart sounds very good. So write that down. Equals 6, 8. Okay, like I said, we're going to be doing cranial nerves 5, 6, 7, 8, and 9. So I'm going to be asking you to put your hands up like so, just like that, and I'm going to try and pull your hands towards me, essentially. I want the back sides of your wrists facing me. I'm going to pull, and I'd like for you to resist. Ready? Arms up like so. And resist, 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 resist. Good. Any issues there? Good. Same thing. I'm going to have you form your hands again like this, and I'm going to push towards you. I'd like for you to resist me pushing towards you. And arms up like so. And resist, 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 resist. Any issues there? No? Good. That was cranial nerves 5 and 6. Let's do 7 and 8. I'm going to get your shoulders. I'd like for you to just bunch them up like that. I'm going to push down, and I'd like for you to resist. So, shoulders up, and resist, 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 resist. Excellent. Any issues? No. Now, I'm going to ask you to have your hands by your sides, palms open. I'm going to try and push up against your hands. I'm trying to push your shoulders up. I'd like for you to resist. And hands by your side. I'm going to push up and resist, 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 resist. Good. Any issues there? No. So that was 5, 6, 7, and 8. No problems there. Number 9. This is one that most doctors don't do. I'd like for you to just follow my finger. I'm going to touch your nose, and then I'm just going to get you to follow my finger whenever I touch it, okay? So, and follow my finger. Follow my finger. Follow my finger. Good. Follow the finger. Follow the finger. Just follow along. Good. No issues there. Let's move on to cranial nerves 10, 11, and 12. These ones include your sight and your motor function skills. I'd like for you to just tell me, how many fingers am I holding up? How many fingers am I holding up? Good. Again, how many? How many now? How many now? And lastly, how many now? Good. Mathematically, your brain is working in terms of what it's seeing and then computing to give me a number. Cranial nerve number 11. Can you tell me, what is this? What is it? A pen light. Good. Can you tell me the color of it, please? What color is this? Orange. That is correct. It's cranial nerve number 11. Now, if you'll recall at the very, very beginning, I said that I would have 12 to go through. The final 12th one, I'm going to repeat a sentence. I'm going to say a sentence, and I'd like for you to repeat it back to me. It's nothing hard. I'd like for you to just say, I went to the market today and got carrots, cucumbers, and beets. Go ahead. Cucumber, carrots, and beets. Good, good. Cranial nerve 12. Recollection of memory in terms of what you're hearing, processing, and telling me back. So, seems to me that, again, no issues at all over there. Let's find the right page. There we go. That's the right one. All right, we got time for the page. Good. That's excellent. Very happy with this. And how are you feeling? Good? Excellent. Margaret at the front desk, my receptionist, will book you in for your next appointment. No payment today. Margaret just requests a comment, a like, and a subscribe. Very simple in terms of what she asks for. When you go see her, she'll give you your next appointment. She requests its terms of payment, comment, like, and a subscribe. And I'll see you in 3 to 6